We have been talking much more about the topic of menopause in general recently, which is great. But today, one of the subjects that women still feel too embarrassed to talk about and will very seldom admit to suffering from is stress incontinence and stress urgency. The declining levels of estrogen during menopause and peri-menopause can cause the lining of the bladder and urinary tract to change. The pelvic floor muscles can become weaker as they lose strength and elasticity, which causes the pelvic organs to drop, resulting in stress incontinence. Don't think that this only affects women who have had children. It will affect all women going through the transition because of our decreasing hormones. If I asked you to go on a trampoline or to use a skipping rope now for 10 minutes, would you feel confident? Or would you make an excuse and shy away from it in case of a little accident? Have you ever had a little leaking when you cough, sneeze, or exercise? If the answer is yes, then do not worry, as this is very, very common in women. Research indicates that between 25% and 45% of women worldwide suffer from stress incontinence, although it should be noted that these are just the women who are willing to admit it. The large range in stats here is almost certainly due to too many people being too embarrassed to be completely honest about their symptoms. Imagine if you were asked if you had any symptoms of incontinence, and perhaps occasionally you do, maybe just when you sneeze. What would you say? Would you still say no because it doesn't really happen that often, thinking that it only happens just occasionally, so that doesn't really count? Most people do. And an amazing 40% of women who are suffering are too embarrassed to consult with their doctor and just accept it as being normal. Part of this is because of the media. TV commercials now are normalising it by promoting Tenna Ladies and similar products, suggesting that it is an inevitable part of life and part of the ageing process, and that we just have to pad up for the rest of our lives, which is absolutely crazy. It is common, but it is not normal, and the good news is that it is totally fixable. For many women, this can be corrected in as little as 6 weeks with the right help and support. There will always be a few cases who can't be completely cured, but until all options have been explored, you should never accept that to be the case. You just need to know where to look, and the answer can be quite simple. Pelvic floor exercises, if done consistently and correctly, can greatly help, and this can be life-changing for so many women. This is an issue that can last into old age if you don't take action. If you don't practice working these muscles, you're more likely to develop a prolapse. This is where one or more of the pelvic organs being supported by the muscles can slip down into your vagina, like your uterus, the bladder, or part of the bowel, causing a dragging sensation around your pelvis and lower abdomen. All of this can have a significant effect on women's mental health and well-being, as well as preventing them from living a life they enjoy and doing the things that they want to do in life. So let's talk a little more about the pelvic floor muscles. These are muscles that run from your pubic bone to your tailbone and include the muscles all around the vagina. They're like the trampoline that supports your pelvic organs. They're tucked up inside of us, so we can't see them, but they are like any other muscle in the body. They can get weak. However, we can make them stronger if we work them on a regular basis. The deeper layer of muscles support the position of the womb, the bladder, the bowel, and basically keep all our bits and pieces in place. As the bladder fills, the pelvic floor muscles support it, and the urinary sphincter muscles keep it closed to prevent the leaking. During the menopause and peri-menopause stage, as the estrogen levels start to decrease, then this can reduce the efficiency of the muscles and cause leaking. Evidence shows if you do your exercises regularly and correctly, you can significantly improve or cure your stress incontinence in around about 84% of cases. So that's a very high stat for you. Estrogen, or lack of it, also has an effect on the urethra tube and their urinary organs and causes stress, urgency, and an overactive bladder. Have you noticed that you're running to the toilet more during the daytime or up several times during the night? Or are you always needing a toilet whenever you go out anywhere? Do you go out of the house to go and do a few messages, even go and do your grocery shop, and then when you're approaching the house, you have an even greater desire to get to the toilet and maybe struggle to get there in time? This is known as stress urgency, and it is so common. I had no idea that it was connected to perimenopause and that it could be helped. So I'm going to talk more on how to help that shortly. So the main symptoms of a weakened pelvic floor muscles that you're looking for, number 1 is leaking when you cough, sneeze, or exercise. Number 2 is needing to pee a lot, constantly running to the toilet. The next one, urge incontinence, where you need to pee as soon as you're near a toilet. Number 4, difficulty emptying your bladder completely. Number 5, feeling a heaviness in your vagina. And number 6 sometimes is leaking during intercourse. So now that we know what our pelvic floor muscles are about, here are some lifestyle tips to help you if you are having problems. The most important thing that you can do is pelvic floor exercises consistently, meaning on a daily basis. You need a mixture of quick lift and squeeze and then slow lift and squeeze. More explanation on the actual movements are included later. So get into the habit of doing these every day. The way that you brush your teeth every day, do your pelvic floor. Repetition is key. Another thing, book an appointment with a women's health physiotherapist for an assessment. If you're not sure you're working your muscles correctly, I highly recommend this, as she'll be able to assess your muscles and give you guidance on what exercises will work best specifically for you. There's also pelvic weights and electrical stimulation gadgets which can be helpful to work the pelvic floor muscles, but these can be effective, but they are expensive and you really need professional guidance here. For some women, they can be really beneficial, and for others, they might just overstimulate and actually weaken the muscles. So please seek advice from someone who knows first before purchasing these. Another thing I highly recommend, download the Squeezy app. This has been created by a lady called Myra Robson, who is a specialist women's physiotherapist in London, and she is passionate about helping women with stress, incontinence and prolapse. It is recommended and used by the NHS, so it has been thoroughly researched and proven to be thoroughly effective. Avoid high impact exercises if possible, as these will put extra pressure on your pelvic floor muscle. Regular yoga and Pilates are recommended as they target the pelvic floor muscles as well as being low impact. Constipation can also have an effect on these muscles, and straining when you're going to the toilet doesn't help. You're advised to put your feet on a small stool or box, to lift your knees higher than your hips in a semi-squat position. This helps as it straightens the angle of the rectum, so basically you're not trying to poo around a corner. Another thing to do is keep hydrated with 6 to 8 glasses of water per day. Dehydration makes the urine concentrated, causing irritation and potentially leading to urgency. And water also helps with constipation. Obesity and being overweight can also weaken the pelvic floor muscles, and even losing a small amount of weight can be helpful. Speak to your GP for advice as well. They can refer you to a pelvic floor physiotherapist or help if you're having trouble with stress urgency, and they may recommend some localized estrogen. This comes in the form of a cream, a gel, pessary or a vaginal ring. The creams, gel and pessaries are used on a daily basis. For example, there's a brand called Vagifem pessaries, which you would use one pessary each night for the first 2 weeks and then twice weekly. However, this can vary due to the individual, and it can be used more frequently if you need to, as the dose is so low. The vaginal ring is inserted and replaced every 90 days, so this is sometimes better for older women or for those who have difficulty inserting daily pessaries due to vaginal atrophy or vaginal dryness. In September this year, 2022, Gina vaginal estrogen was made available for post-menopausal women to buy over the counter in pharmacies in the UK for the first time, which was amazing. However, it's not just straightforward and easy to purchase, as the pharmacist has to ask you a lot of questions, and it's £30 for a packet of 24, so it's maybe just easier to go and chat to your GP if you can get an appointment with them. These all contain estrogen, but in really small doses. Using the pessaries daily for 1 year is the equivalent to just one HRT tablet. Around 10 to 25% of women who take systemic HRT will still have urogenital symptoms that persist and conditions that we've just described. So it is still safe to take your HRT and use vaginal estrogen. The good news is that research has shown that the clinical response with topical estrogen is usually really rapid and sustained, so it should work for you very quickly. An added bonus is that the vaginal estrogen can often improve urinary symptoms, including constant UTIs and vaginal dryness. For the majority of women, symptoms return after treatment is stopped, so there's no need to be stopping your treatment. Continue with it. Personally speaking, I can highly recommend using these or even trying them out and see for yourself. I have been using the Vagifem pessaries and they have been amazing. I can now go out for several hours again without needing to run to the loo every hour. I had even stopped going out for long walks in case I couldn't find a toilet, and I have since spoken to so many women who were the exact same as myself, and they had no idea that something so simple could be so effective. Another wonderful way to help you through any symptom is by booking yourself in for a menopause reflexology session. I am based in Jordanstown in Northern Ireland, but if you're not close by, research someone in your area who has undergone specific training for menopause reflexology and have this on a regular basis. Food and nutrition that may help. So first thing, sufficient protein is important to building and strengthening your muscles. Your pelvic floor muscles are like all the other ones in your body. They need protein as their building blocks. Second, eat plenty of fibre in the form of oats, brown rice, wholemeal bread, vegetables that will support good digestion and help reduce the risk of constipation, which obviously puts pressure on your pelvic floor. Vitamin C found in fruits and veg help maintain collagen, which preserves the elasticity of the muscles, and tissues, which support the strength and the effective action of the pelvic floor. Foods that contain phytoestrogens, edamame beans, linseed, chickpeas, pulses, whole wheat, oats can help stimulate estrogen receptors in the vagina area. Fermented foods such as kefir, kimchi support healthy bacteria in the gut, which also helps for a sluggish bowel. Calcium and magnesium rich foods are important as they support muscle function and help to control muscle spasm, which can cause leaking. Magnesium also encourages peristalsis, which is the contraction and relaxation of the muscles that help push stools through the bowel and prevent constipation. And try and keep your blood sugars balanced to help with weight management and reduce your levels of stress hormones. A few foods to avoid: any caffeinated tea, coffee, energy drinks, cola. These all have a diuretic effect which can increase the amount of urine you produce and stimulate the bladder, causing a sense of urgency. And also watch out for spicy foods, citrus fruits and acidic juices, which might also lead to an overactive bladder. So now pelvic floor exercises. Quick word on those. There's two types, the quick and the slow. The slow ones are there to hold everything in place and keep a general tone all of the time, whereas the fast ones are there to help when you put pressure on your pelvic floor, when you cough, sneeze, etc. So here's a really basic guide on how to start these. Sit on the chair, uncross your legs, take your knees slightly apart and keep your hands on the top of your thighs. We're going to start with the faster ones where you will hold for 2 seconds and then release for 2 seconds. So think about being desperate to pass wind and pull up the muscles around your back passage, and now pull that muscle right up your front all the way to the top of your pelvis area. Imagine it's like a zip running from the back passage to the front of your pelvis. So you should feel a squeeze, lift and pull. It can be hard to feel it correctly at the beginning, but you just need to practice, and don't hold your breath while you're doing these. The slow ones are going to work the same way, only you will hold in for 10 seconds and then breathe out for 20 seconds. As you inhale and extend your tummy, then on the out breath is when you want to squeeze in. I found this really hard to manage at the beginning, but just keep practicing that one. It's important that you relax the muscles then for 20 seconds so that you don't overwork them. It's like working any muscle in the body. They need strengthened and then they're going to need relaxed. So you hold in for 10 seconds and you release for 20 seconds. Do both of these maybe 2 or 3 times a week, but the Squeezy app will help you remember to do these exercises, and I highly recommend you download it onto your phone, as it's hard to remember to do these on a regular basis and to do them consistently. These are rough guidelines, but please book an appointment with a specialist physiotherapist who can make a treatment plan tailored to you and your needs. So I hope, as always, you have found this helpful, and if you have any tips or anything that you would like to discuss on this topic, then please do comment below. And anyone else who you feel might want to join the group, then please do feel free to add them in. So thank you, and I will catch you all again soon.